Our goal is to use International Women's Day to draw attention to things that could be done better for women and their health.
And your business is of course focused on women's healthcare and making it more equitable and accessible in the UAE and around the region. Just how big is the problem that you're trying to solve?
So there are about 645 million women in the Middle East, Africa, and South Asia. And these are women that still today are largely excluded from mainstream clinical trials and research. And to kind of understand the implications of that, step back a few years. Until 1994, women were largely excluded from clinical research and trials, which means that still today, a good 20, 25 years later, women are still 50 to 75% more likely to suffer adverse reactions to drugs than men. A really good example actually is the way that local populations here in the region have responded to COVID. For example, if you are from Bangladesh or Pakistan, you're 3 times more likely to have a very severe reaction to COVID than your white counterparts in the US and Europe. So I think the issue of the health of the general population in the region and opportunities to innovate where that's concerned are huge. And then if you take the lack of focus on women's healthcare more generally, the opportunity is great.
And Sophie, when you reflect on the impact of the pandemic, just help us understand why women have been so disproportionately impacted by COVID-19.
I think it's a difficult question. Why fundamentally have women been more adversely impacted than men? And all of the research that's been done suggests that this is the case in terms of taking on the burden of homeschooling, additional home tasks, being adversely affected from a retention perspective in the workforce, in terms of funding. So we're down to pre-2017 levels in terms of female-led startups securing venture capital funding as of last year. I think fundamentally because the empowerment of women within a broader context of diversity inclusion is a relatively new concept again, and therefore perceived probably by all of us on some level as being a little bit risky. And when we're in a crisis, we tend to default to things that are perceived as less risky and in fact take as few risks as possible. So I think if within society, women still predominantly have the role of the primary caregiver, even if there have been sort of subtle shifts in that over the past decade, as soon as a pandemic hits, then that's the default that everybody reverts to. So I would suggest that that's what lies at the heart of everything. But, we live in a new age now. Women are increasingly empowered, hold more positions on boards, run more companies, progress more in their careers, establish more varied and flexible work-life balances. So I think one of the big questions for 2021 is, firstly, how do we ensure that we get back to where we were from an equality of opportunity perspective? But also, how do we support everybody, and particularly women, with recovering from the pandemic from a mental as well as a physical health perspective?